Hi, everyone. This is Bob Dietrich with the ADHD Toolbox. And today we have a very special guest. Russell Barkley is with us. And Russell, thanks for being on the show.
My pleasure, Bob. Thanks for having me.
Well, Russell, everyone I've talked to is like, wow, you've got Russell Barkley on the show. I mean, you are a big name in this field. So tell us a little bit about yourself and why you get this legendary status.
Oh my, yeah. Well, I'm not sure I want to talk so much about that, but
Yes.
currently I'm a clinical professor of psychiatry at the Virginia Commonwealth University Medical Center here in Richmond, Virginia. And I just do some part-time teaching down there with interns and other trainees at the moment. But in addition, I continue to speak internationally about once a month. For instance, on Monday, I'll be heading to Australia for some lecturing there. And then I continue to write books. I've got, 25 books at various stages out there in different editions and so on. And of course, I've published a lot of research, several hundred articles and book chapters and so on during my 40 or so years of being in this career. So, you know, with all the books and lectures and publications and everything, I've sort of developed a reputation for having some expertise in this area, and it's wonderful. It's I'm delighted to be able to pay it forward and give a lot of information to people about ADHD.
Yeah, well, it's phenomenal, and I know people certainly appreciate what you have to offer. If you go to Amazon and you Google just ADHD, your name comes up at least a dozen times.
Oh my!
So you have you have a ton of stuff out there, and it's so valuable.
Thank you.
And I mean, we can go so many directions with this conversation, but you got something very special that you've been talking about lately. What is that?
Yeah, well, as you know, in my career, one of the things that I valued even more than most of my colleagues is disseminating the science of ADHD out to the people who really need it, which are the families, the patients with ADHD, the practitioners as well, rather than just publishing in a journal and letting it go at that, as many of my colleagues do. That really doesn't help very much, and it takes too long for that information to get out. And I like to take it directly to people through my lectures and through opportunities like the kind you've graciously provided me to do here to get the latest findings in research out there. There's more than 30 to 50 articles a week published on ADHD. I know because I track them and read all the abstracts every Friday. That's 1,200 articles a year or more that's going on in the research, and the public doesn't know that unless someone takes the time to organize and disseminate that information. So what I want to do here is talk about what's been happening in the field the last few years that is broadening our awareness of ADHD from a mental health and educational disorder to what is clearly a public health disorder because of the adverse effects ADHD has on many areas of health and lifestyle, all of which can sum over the course of your life to have a detrimental impact on your risk for early mortality and life expectancy. So that's really the message I'm trying to get out currently through a variety of means, including a CHAD summit that's going to take place in October in Washington, D.C. on this topic, as well as speaking frequently, as I will be in my upcoming talks, about this particular area, because I think it's a very under-identified area of need for families and people with ADHD.
Yeah, agreed. We have tons of people coming on this this ADHD Toolbox to talk about different aspects of it, and you could talk about all of them. And this is the best topic for you to talk about because you're right on it, and you've just prepared this presentation and given it to a couple different audiences, and you're going to share it with us now. I understand.
Yes, I am, because last year at the CHAD meeting and earlier in the year at APSARD, which is the American Professional Society for ADHD, this was the presentation that I focused on there and got a resounding positive response. In fact, one individual said that this was really a gut check for professionals and families about an area that they were neglecting that was very important, more than others that we tend to pay a lot of attention to. So let me just summarize some of the information I want to put into the toolbox here for
Perfect.
families to be aware of
Hmm.
about these health risks that are associated with ADHD, and then just talk a little bit about the implications of those. So just bear with me a moment as I sort of try to share this screen that I've got up with you. A couple of buttons here that I need to bring up.
Yes, and
And
Dr. Barkley's going to be sharing his screen and showing you the slides that he uses as we follow along
yes,
with the presentation that he's
yeah.
done for other audiences recently.
Uh,
This is the latest
Indeed,
stuff.
and it sure is. And it's based upon some research that we just published a few months ago in the Journal of Attention Disorders, as well as the accumulation, of course, of earlier articles related to my own research that were supportive of it. So here I just want to talk about what's been going on in the last 5 to 10 years of accumulating knowledge about the health risks associated with ADHD. I hope that you can see
Yes.
this slide. And we've known that ADHD is related to a variety of health impairments for many years. For instance, going back even into the 1960s, we've known that people with ADHD are much more prone to accidental injuries, not only in childhood, excuse me, but going forward into adulthood. This is largely driven by their impulse control problems and failure to contemplate the consequences of their actions. And as a result of these accidental injuries, are much more prone to traumatic brain injuries, and especially repeated traumatic brain injuries, whether it's through sports or just general play or motor sports or driving. They are really placing themselves at high risk for multiple closed head injuries besides accidental injuries of all stripes. And of course, a subset of people with ADHD are prone to reactive aggression and other forms of violent behavior. And that can lead that subset of people into, of course, being exposed to injury, trauma of all sorts as a result of the retaliation by their victims. And then we've known that teens with ADHD engage in a variety of risk taking when it comes to sexual activity, as well as not protecting themselves through the use of contraceptives. And all of that leads to a greater risk for being exposed to sexually transmitted disease, and more importantly, to a risk of about 30 to 40% of having a child during their own adolescent years before they reach 19 years of age. And of course, if you're pregnant and you're an adolescent, that brings with it a variety of health complications as well. And then in the long run, because of their risky sexual activity, they tend to have more sex partners, and that puts them at risk for HPV infection, which of course is the leading cause of cervical cancer and an increasing cause of throat cancer in men. So there is this risk that goes along with risky sexual activity as an adolescent and young adult. By the time these people reach adulthood, we see a lot more complaints about just physical health in general, feeling more fatigue, more headaches, less well, more stomach aches, and vague bodily complaints that they might report when we interview these young adults. Lately, there's even been some evidence that females in particular with ADHD might have a greater risk of fibromyalgia syndrome, again related to their impulsivity. And now we have evidence that there is a genetic link between ADHD and migraine headaches that our patients have often talked about, but now we've seen in the largest genetic study published to date that these are genetically shared disorders with each other. And that's important for people to know about as well. Besides those risks, we know that people with ADHD do not eat well. They tend to engage in a fast food, Western style, high carbohydrate, high snack and sugar loaded diet.
Mhm.
And that can lead to increased dental problems, not just dental caries and dental plaque, but the risk taking itself can also lead to increased trauma of their dentition. And then because of their self-regulatory problems and their poor habits, they may not engage in appropriate oral hygiene, which again puts them at further risk for these various dental outcomes. More recent studies have shown that people with ADHD have 3 times the risk of obesity during adolescence and adulthood which of course makes sense given everything I've already said about their diet and their lack of exercise, or less likely to participate in exercise, more likely to engage in sort of sedentary activities. And so by adulthood, at least 2 to 3 times more of them are classified as obese. And that puts them at risk, as you well know, for type 2 diabetes. And you can see the increase in odds here of being 2 to 3 times more likely to develop type 2 diabetes in adolescence and adulthood. The girls in general, the females, are at risk for eating disorders and just general eating pathology. And as you see here, it tends to be about 4 to 5 times the risk of some type of eating problem related to impulsive and binge eating. And a lot of that, of course, comes back to their impulsiveness as part of their symptom presentation.
Right.
And then as they move into late adolescence and adulthood, a higher propensity for tobacco use, use of marijuana, use of alcohol, and then having much more difficulties quitting these forms of substance use and abuse. And of course, these will predispose toward other risks later in life, as you well know, such as the risk for cancer, as well as a documented risk for cardiovascular disease, as you are seeing here, which we have found in some of our research as well. And then most recently, there seems to be a growing risk for early dementia, as well as disorders like Parkinson's, that are disorders of the basal ganglia in the brain. And then most recently, a genome-wide scan of the entire genome in more than 35,000 people with ADHD began to show that there were genetic links between ADHD and a lot of these lifestyle factors, such as obesity and cardiovascular disease and so on. So there's a lot that's been going on in this field over the last 5 to 10 years, all of which would suggest, and you don't have to be an insurance agent to see it coming, or even work in epidemiology and public health, but if anybody would look at these and say, my God, there has to be some longer term effect on mortality if you keep engaging in these various activities and lifestyles. And lo and behold, in the last few years, that's exactly what we have seen. This is a busy slide. I'll just summarize it very quickly. There's been a life course study done in California that has gone on across the lifespan of gifted children from their childhood up through the end of life. And Friedman is the most recent researcher to report on this Terman longitudinal study. Terman was the developer of the Stanford Banana Intelligence Test, but he also started a life course study of gifted children. And what this study found is that the single best predictor of life expectancy in these bright children was low conscientiousness. That is, if they were very impulsive and it showed poor self-regulation in childhood, which is what we mean by being low in conscientiousness, this personality trait, they had a life expectancy that was 7 years shorter than people who were more conscientious and less impulsive across the lifespan. And this applied to death by all causes in the study. And he was looking at people who were just in the bottom 25% of the population. Now, ADHD is the bottom 5% of the population. So if Friedman was finding this shorter life expectancy in 25%, the lowest 25%, we would expect to see it even worse in people in the lowest 5%, which are people with ADHD.
Can I ask a question here? Back
Yeah,
on
sure,
that
sure.
last slide?
Go ahead, Bob. Yeah.
Go back to that last slide if you could.
Surely, yeah.
And so how does conscientiousness show up with people with behavior and
Yeah.
lifestyle?
Sure. Well, people who are low in conscientiousness don't think about the consequences of their actions, their behavior, their choices, the way other people do. They tend to engage in them rather rashly, impulsively, heedlessly, some would say even irrationally, because they're just not stopping to think about what's going to happen if you make that choice, if you decide to do that. A conscientious person makes decisions with regard to their conscience, with regard to thinking about the now versus the later. How will this impact me? How will this impact other people? How will this affect my long-term welfare?
Right.
And
Looking
that
at
is
the
what we
con.
mean by being conscientious. And people with ADHD are very low in this personality trait because they are highly impulsive individuals who don't show a lot of hindsight and foresight and regard for the consequences of their actions. And that's kind
Right.
of how it plays out with ADHD. And we've known that for quite a while, that this
Got it.
personality trait is very low in people with this disorder.
Got it.
And so here we go. We start to see in a variety of studies, for instance, McQueenie's study, that people with ADHD who miss a lot of appointments with their mental health care workers
Hmm.
have a shorter life expectancy, are 8 times more likely to die young than people who keep their appointments. Now, what does that have to do with ADHD? Well, you and I both know from being in practice in the ADHD field that people with ADHD miss a lot of their appointments because of their time management difficulties,
Hmm.
their lack of organization, their
Hmm.
impulsivity, and so on. They miss a lot of these appointments. So by inference, we could use the study to say, gee, we might expect to see a shorter life expectancy in these people. And
Right.
then we have the most recent Lee study published last year that followed 120,000 people. These happen to be nurses, and followed them for at least 34 years and identified 5 high risk behaviors that would increase your life expectancy if you paid attention to these and didn't do them, or if you didn't engage in these health behaviors and therefore put yourself at risk. So, did you smoke or not? Did you exercise moderately or not? Did you try to keep your body mass down, your weight down? Did you engage in moderate or less alcohol intake? Did you use a high quality diet, or was it a high carb, high sugar diet? And then, of course, if you added up how many of these lifestyle things did you engage in, the Lee study found that that people who engaged in all 5 of these lived 12 to 14 years longer than people who didn't. And as I've already pointed out, people with ADHD tend not to engage in these lifestyle factors. So again, by inference, we would assume that they would live 12 to 14 years less
Hmm.
because they're not doing any of these things on average. So again, all suggestive, but here's your direct evidence now, which has appeared in about the last 5 to 7 years. One is a life course study of ADHD children followed up until they're about age 41 years of age. And what we're seeing is that 3 times more are likely to die by their 40th birthday than are people in the control group. We have a study out of Syracuse by London and Landis showing that adults with ADHD have twice the rate of mortality over any 4-year period than do control people in the
Hmm.
population. And then just a couple of years ago, Dalsgaard, who used the entire Danish population, found in their study of their medical records that people with ADHD were twice as likely to die in childhood from their misadventures and were more than 4 times as likely to die in adulthood, most likely due to accidental injury, although there was a slight increase in death due to suicide in these adults. So, here, that's rather sobering to know that if you're an adult with ADHD and it's not being managed, you're 4 times more likely to die by 45 years of age. Again, very consistent with the Klein study that literally did follow people with ADHD across the lifespan. And then just a few months ago, at the end of 2018, Virtanen, using the Swedish population database, found very much the same thing, 2.5 times the risk of early mortality in people with ADHD. And if they happen to have another disorder along with their ADHD, the risk of mortality might go up even further, such as if they had autism or intellectual disability. And then just a month ago, a study in Taiwan, again using all the records, the medical records of people living in Taiwan, demonstrates yet again an increased risk of earlier mortality by suicide, homicide, or accidental injury. And then also just within the past 2 weeks is the Sun study, again using the Swedish database, that again documents higher rates of mortality. So all of this is showing that this isn't just circumstantial evidence, this isn't just inferential or suggestive. We really are seeing a greater risk of early mortality in early life as a result of accidental injury primarily. Now, what did my study do? And then I'll stop sharing my my busy screens with you here. But
Mhm.
my study said, okay, given everything we've just seen, and given that I have my own longitudinal study,
Mhm.
and given that people with ADHD are engaging in all kinds of adverse health and lifestyle factors, what would happen over the course of their entire life? Now, remember, these earlier studies are documenting mortality in early life due to accidents. We ask a different question. What's going to happen in midlife and later if you keep engaging in unhealthy lifestyle practices? So we took and used a life expectancy calculator available through the University of Connecticut, in which you enter 14 different variables related to age and sex and height and weight and income and health and sleep and nutrition and exercise and smoking and driving and so on. And if you take all of this information, which we had in my Milwaukee longitudinal study,
Mhm.
and you now entered it into this calculator, what would it tell you about what you could expect for life expectancy? And we did that, and here's what we got. If you were diagnosed only in childhood with ADHD, regardless of whether you grew out of it or not, and remember, about 14% at a minimum of people with ADHD do tend to outgrow it by age 30. About 86% don't, but nonetheless, some do outgrow it. But just regardless of that, if you were diagnosed in childhood, as you can see on the left-hand side of my slide here,
Mhm.
you're going to live 9 years less than other people in terms of healthy years, and about 8.5 to 9 years less in terms of total years of life expectancy. So just knowing that, I don't need to know anything else about you. Were you ever diagnosed in childhood with ADHD? If you were, then you're in trouble if things continue the way they're going to for you. Now, the next thing we ask is, what if your ADHD persisted to age 27? What happened then? So here we see three graphs. We have the kids whose ADHD persisted. The middle bar is the kids whose ADHD did not persist. Many of them were symptomatic but not diagnosable. Some of them had outgrown it. And then there's our control group in the light bar here. And what do you see here? You see a nearly 13-year reduction in life expectancy in those whose ADHD persisted into adulthood and was largely untreated. Even the non-persisters had about a 7 to 8 year reduction in healthy life and about a 7 to 9 year reduction in total life over here compared to the control group. But boy, if your ADHD stayed around and you weren't getting treatment, you were going to lose between 11 and 13 years in your life expectancy. That is a very sobering finding. And I'll tell you why in just a moment. But some people are going to ask, well, why? What was it about these people? What was it entering this calculator that was doing this? And here's all the things that the ADHD group was doing in adulthood that was predisposing toward shorter life. And it's all the things we've talked about, so I won't belabor the point here. But what I want to point out is we then looked at, all right, why are people with ADHD doing this? Engaging in all of these various lifestyle risk factors. And you see it here. It's behavioral disinhibition. It's low conscientiousness. It's impulsivity. We could explain 30% of the variation
Mhm.
in your life expectancy based on knowing one thing about you. How disinhibited, how low in conscientiousness were you in this area of executive functioning? So basically, we replicated what health psychologists have been reporting for 30 years. Starting in childhood, the best predictor of how long you're going to live is disinhibition, low conscientiousness, and we essentially replicated that. Now, why is that a stunning finding? Well, first of all, it's never been reported before in the ADHD field.
Mhm.
And secondly, it's stunning because it means that ADHD is worse than the big five killers in the United States combined. Our government spends billions of dollars trying to get people to stop smoking, to reduce their alcohol, to get more sleep, to engage in exercise, to adopt a better diet, and so on. And we're spending billions on each of these things every year to try to get people to stop this stuff. And ADHD is worse than all of them combined. because each of them only discounts your life by about 2 to 6 years. ADHD is 13 years. And the reason that ADHD is worse than all of them is ADHD is predisposing to all of these risk factors. And as a consequence, ADHD provides an accumulation of all of these risks together, a summation of these risks. So ADHD, as we're trying to teach people, is very bad when it comes to your health and longevity. And people don't know that. They don't take a look at the lifestyle arena, at the public health arena, when it comes to ADHD. And even if they look at these things, like you're in primary care and you're trying to help people eat right, lose weight, quit smoking, sleep better, exercise more, what the primary care person is not doing is pulling back the curtain to see, why were you doing this to begin with? Why are you having such trouble regulating your life in a healthy way? And there it is. The big gorilla in the room behind that curtain is your ADHD symptoms and behavioral disinhibition specifically. And nobody looks for that. Nobody asks about that. So when you fail at a smoking cessation program, does your primary care provider say, gee, I wonder if you have ADHD? No, they don't. They don't even think about it. It's not on the horizon. And by not thinking about it, they're not going to be able to treat you very effectively. They're not going to be able to help you live a better, healthier, and hopefully longer life. So that's the message we're trying to bring, that ADHD, through its impact on self-regulation and impulsivity and conscientiousness, is a very impairing disorder when it comes to health and lifestyle, and as a result is predisposing you more than any other factor we have found to a shorter life expectancy if you don't get this treated and treat it seriously and consistently. So there you have it.
Wow, that's very, very sobering information. Um, there's a stop share button on the screen there. If you,
Yeah, I'm trying to, oh, there it is right there. It's hiding from me. There we go. Thanks, Bob. Yeah.
And
So thanks for tolerating that. But I did want to bring the gospel from the research, according to Barkley here, of what we've been learning in the past decade, and that I find people are relatively ignorant of.
yeah, fascinating stuff. You know, if you just watch this, I invite you to go back and watch it again, because this is sobering information that really, if you're dealing with ADHD, you must know. And I think the alarm bell here is get treatment for it. Work
Yes.
with the treatment. And what are some of the treatments that you found to be in particularly helpful, Dr.
Yeah. Oh, yeah. Well, thank you for asking. I think the first thing, and people won't think of it as treatment, but you and I do because we know better. The first step in treatment is to get evaluated, get an appropriate diagnosis, identify any comorbid disorders, because in 80% of the time, there's at least one other disorder there besides ADHD, whether it's learning problems, anxiety, depression, autistic spectrum. We need to identify those too because they're relevant. But here, what this information tells us is that in addition to getting an appropriate professional evaluation, the evaluator, the clinician, needs to broaden the lens of the evaluation away from the usual domains that we focus on, like education and adjustment and your occupational functioning and your social functioning. We need to broaden that lens into the lifestyle variables of health and wellness. How are you eating? What is your weight like? How are you sleeping? How are you driving? What are you consuming? What are you smoking? What are you drinking? And we don't tend to ask those things very much. We tend to stay away from health and wellness when we do mental health evaluations. So step one, families need to make sure that they are paying attention to these health domains and that the professional evaluating their loved one is paying attention to these health domains. Because we can't do anything about it if nobody's looking, if we're sort of not looking behind the curtain and we're not looking at the larger profile of the patient from a wellness perspective. We are not doing these people any favors, and we're certainly not helping them extend the quality of life and life expectancy. So that to me is step one. Be aware, broaden the lens, focus on lifestyle, wellness, and health, and let's see where the problems are. And then, of course, let's get busy trying to change these lifestyle factors. And you and I, we don't have time to go through about how do you increase exercise, how do you eat well, how do you improve sleep.
Right.
There's plenty of that out on the internet. You just Google that stuff and you're going to get all kinds of recommendations.
Right.
What I really want to emphasize here is when you try to do those things, if they fail, if you're not successful at them, then get your ADHD treated. And that means treatment with ADHD medications, with cognitive behavioral therapy. If you have a child, it means using the evidence-based parent training and school management approaches that you and I know and implement so well with people. Get the evidence-based package of interventions going, because they, once they're implemented, are going to allow you to then improve your self-regulation, improve your health and lifestyle. But if you're not dealing with the underlying ADHD appropriately, then you're not going to address the lifestyle factors very well either. So you got to do both. And it means getting appropriate intervention for ADHD, including in 70% or more of the cases that may result in medication.
Now, many of the viewers of this particular episode of the ADHD Toolbox have younger children, maybe
Yes.
5 or 7, and getting treatment at this age, that's what they're engaged in at this point.
Yes.
You're watching this video.
We hope so.
Right. And would you say that that by being engaged in treatment, cognitive therapy, having coaching and having those coaches help them with the executive functioning and things like that, does that carry forward into teen years? Is that something that sticks with them moving forward into their teen years and adulthood? That type of help?
Well,
training?
if you, it's a great question because it reveals a major problem we've identified in every longitudinal study that we've done. And that is that unless families, loved ones, and patients, along with clinicians, unless we actively team up to ensure that treatment continues into and across those adolescent years, what every follow-up study found is that most people disengage treatment during the adolescent years, going from 80% are involved in childhood to less than 10% by age 21. So those years are critical for people who are not complying with treatment. And as a result, these studies have found that childhood treatment, when not continued through adolescence, has no impact on adult outcome, none whatsoever. You can be as vigilant as you want to about getting medication, special education, parent training, coaching, and other things for your child. But if those don't continue through adolescence, you have done nothing to alter the life course of that individual. So that the longitudinal studies are coming back to the point that you're making, which is that adolescence is crucial for altering life course of someone with this disorder. It doesn't matter what you do in childhood so much as did you continue it. And that's hard because the ADHD teen is not the easiest person to get on board in a treatment plan. They don't think they have a problem. They didn't call you. They are not owners of their disorder, so to speak, the way a diabetic would be. And I'm encouraging people to think about ADHD the way we think about diabetes now, to work with the patient, to get them educated, to make them a stakeholder in their own disorder. And as Adam Levine says in his YouTube video about adult ADHD, because he has adult ADHD, to own it. If you don't own this like a diabetic owns their diabetes, you will not engage treatment and you won't continue what treatment you have engaged through these adolescent and young adult years.
That's
so
great.
Man, is that critical to do.
Yes.
So we really have to retool our work with teenagers to get them to buy in.
Yep. And I think, people like Adam Levine and other celebrities,
Yes.
pop stars, whatever, can really help make a difference by owning it and, coming on a show like this and doing that, just to raise awareness. Like, I want to be like that guy. He's owning it. I'm okay. I'm okay. That's okay that I've got that too.
You bet.
Let me ask this question because, geez, if I'm a parent with a young child, I might think, well, geez, all the work I'm doing now doesn't matter so much. It's going to be 5 years from now, but that's not the case, right? I mean, what
That's
you
right.
do now is super important because it prepares them for how they're going to continue to implement that, right? So it's
Yes.
very important to implement it at a young age, but it's even more important to continue that past there, because that is the point where if they get it through adolescent, they're going to
Yeah.
take it into adulthood.
It is never too early to intervene. I think your message here is right on point, and that includes in the preschool years. We now know both the American Academy of Pediatrics, American Academy of Child Psychiatry, and others,
Mm-hmm.
including the CDC, are all arguing that the earlier you diagnose this, the better, because you can, first of all, prevent a lot of conflict going on in families, a
Mm-hmm.
lot of harm, a lot of damage to self-worth and self-image,
Mm-hmm.
a lot of problems with parenting, including divorce.
Mm-hmm.
All of these are preventable outcomes from unmanaged ADHD in the preschool years. We can
Right.
also lower the risk of comorbid disorders. You're less likely to develop oppositional disorder and conduct disorder if you were treated as a preschool or early childhood. You're more likely to engage in school and do well there because of earlier intervention. And we now know that at least a subset of kids, if they take their medications and take them for several years or longer, you're actually promoting brain growth in critical areas of brain development by using those medications, which very few people talk about, but is evident in at least 30 or more studies. So yes, get in early, but the other message here is sustain it. This really is the diabetes of psychiatry. And like diabetes, nobody ever comes to you and says, how long do I have to take my insulin, watch my diet, watch my hygiene, exercise better,
Right.
keep my weight down.
Yep.
Nobody asks that if they're a diabetic, because that's forever. And to me, that's the same model we need to use for ADHD as well. So
So a
like you said,
lifestyle.
yeah, start
That's
in
it.
early
Yep.
and sustain it over time, and you'll
Yep.
be doing about as good as you're going to
Right.
do to help improve the quality of life and the life expectancy of
Right.
your loved one.
Awesome. So managing ADHD is a lifestyle that you must embrace, own, and
Absolutely.
and plan to take through childhood or through
Yeah,
adulthood. So
you bet.
awesome.
You bet. Yeah.
Well, thank you so much, Dr. Barkley. This has been a fascinating discussion, a sobering discussion, but something we all need to hear because it really changed our mind. This isn't like something, we get through and it's done and now let's move on. It's like, this is something that we need to incorporate into our daily lives, that this is something, it's just part of who we are. We're going to work with it, and we're going to own it.
Absolutely. And one final thought to remember is this: you are dealing with the most treatable disorder in psychiatry. There is no disorder that responds as well to treatment, that has as many treatments, that improves the disorder in as many people to this degree as we see in ADHD. So there's a lot of hope. Everything we've talked about here is changeable, it's malleable, it's
Mm.
treatable. The real trick is to get that treatment and to sustain it. So thank you for sharing that message.
Thank you. Thank you for sharing your message. I hope you are able to spread the word like crazy, because this is a very, very important message and very, like I said, very sobering. And, as long as we have the right perspective, we can make it happen. So thank you, Dr. Barkley, for coming on our program. And thank you all for watching the ADHD Toolbox. We will see you on the next episode.